Hello and welcome to Courageous Doctors, the new show for you and your doctor. Now let's get started. On today's show, we're going to be talking about Obamacare updates, general health information around the world, and health and safety tips. On Obamacare updates, Politico says that we now, this year, have 8.8 million that signed on to the exchanges. 2.5 were on state-run exchanges, but if you total everything together, 11.8 million. And that is down by 3.7% from last year. Now, the Star Ledger says that according to the Eagleton Center at Rutgers, we have 560,000 people in New Jersey that still lack insurance. And according to Gallup polls, we have 3.2 million, as we said, that are still without insurance. So we still have a lot of work to do. Our new Secretary for Health and Human Service, Alex Azar, the former CEO of Eli Lilly Company, was confirmed by the Senate, so it's official now. And I believe Secretary Azar has as one of his primary goals to reduce the price of drugs. CHIP is finally funded. You know, that was the big battle going on in politics this past semester, where the Congress was trying to get a budget. CHIP, which actually is a very small part of the healthcare budget, less than 1%, was being battled around along with family health care centers, but that's all in there now. And so, fortunately, children will have their health care. Star Ledger says that New Jersey Governor Murphy will replace the funds for family planning clinics in New Jersey that were cut by Governor Christie, about $7.5 million. Wall Street Journal, this is interesting. And actually, it's kind of pathetic when you think about it. Healthcare spending was up in 2016, according to the Healthcare Cost Institute. And here's the bad part. We were spending a lot more money for fewer services. So we did not get a bang for the buck there. We were being hurt. And some specifics, and in addition, out-of-pocket spending went up. So, for example, the Healthcare Institute looked at the price of drugs, ER visits, and the cost of surgery all going up. ER visits went up 31%, which is just astounding. Wall Street Journal goes further into this and says, why are the drug prices so high? And they've been, I've heard debates in Congress on this. You know, we all have the C-SPAN debates, and it has everything to do from not having enough generic competition. When a drug is on going off patent, there may not be enough money in the market if the market for that drug is not big enough for a generic company to come in and take over, or if the generic company is the only one on the market doing something, they can raise the price. And then we have the cost of the middlemen, the distributors, who actually are in business to work for big insurance companies and other big medical groups that have huge numbers of patients, and they want to be the ones to figure out how much the drugs will cost and ship these drugs and distribute them. So the pharmaceutical companies have said in testimony, don't look at us. If 16% of the GDP is the cost of drugs or something like that, I forget the actual number, but whatever goes into the cost of the drugs, and only half of that is the actual pharmacy cost to research it and develop it. The other part is to what the hospitals charge and what these middlemen distributors. So the pharmaceutical companies, I heard testifying in Congress, had said, well, you know, we give rebates, but the rebates go to these huge distributor companies and somehow never make it back to the patient. So go figure. Congress is working on it, and good luck to Secretary Azar as well as to our FDA person, Federal Drug Administration person that's working on the same problem. JAMA did a editorial on Hugh Reinhardt. Hugh Reinhardt has passed, as you know, he's a very famous healthcare economist right here at Princeton, and I had the privilege of being on television a couple times with him. Just a brilliant man with a long career, and but he has an interesting focus on how to look at healthcare. Everybody's been saying, from President Obama all the way down, that The problem with with American healthcare being a lot more expensive than Europe and other countries is that we, as doctors, were ordering too many tests. And I always felt funny about that because I'm only ordering what I have to, so what the hell are they doing, excuse the French, in Europe? Aren't they taking it? I'm sure they're doing the same thing I'm doing. Well, this very famous economist, Hugh Reinhardt, backs me up and all other doctors. We're not ordering too many tests. We're doing what we need to do, and the insurance company has full oversight on us. They're not going to let us do more than what we have to. For some reason, the tests in America are just a lot more expensive. So this famous economist says it, and I was really glad to hear that. Hugh Reinhardt also asked the question, what percentage of gross domestic product of GDP can the U.S. actually afford to spend on health care? And that opens up the whole issue of how much we're going to spend on Medicare and Medicaid, which makes up 1/3 of the non-discretionary budget. Okay, let's move on to other healthcare news. Looking at public health issues, there's as you know, a massive pandemic flu. I mean, I've been so busy in my office, and it's scary, but it happens every year. We get a lot of children and adults dying, and they said this year, particularly the problem was that we're seeing a different form of the H3N2 strain, and wasn't covered well in the vaccine. But the Dr. Fauci, the head of the National Institute of Health, has said that we absolutely need to take the shot because out of those people that had died, they did not have the vaccine. So the vaccine at least has some help. And I have to tell you, I've seen it myself in the office, that it's made a big difference having the vaccine. There's another measles scare at the Newark airport. Apparently a college student was coming in from Indiana, and this was back in January. I think the scare is probably over now as of February, but we certainly want to keep an eye on that. The Public Health Department of Health said that Oregon State University had 5 cases of meningitis B. CNN says that there are 1 million cholera cases in Yemen, and that's just a mess out there with the civil war. Nobody can get help, and it's just horrible. Fox News says we're still having trouble with the Vibrio infections. As you remember, we reported on this in the past. In the Gulf Coast states, our southern states, swimming in these Gulf Coast waters, there's a lot of Vibrio, which is the same bacteria that causes cholera, but it can cause what we call flesh-eating diseases and sepsis, and it's killed people. And you can also get it eating raw oysters and fish that come out of those waters that aren't cooked. So just please be careful if you're going for a swim in the Gulf. NBC News says we're still having trouble with the romaine lettuce epidemic, and the government has no idea the source of this. We think it may have come out of Canada. We're not sure, but it's all over the United States. So please be careful with the romaine lettuce. Wash it really carefully because we don't know where it's coming from, but it's infected with E. coli. Time magazine had said that, this is interesting, 48% of Americans aged 14 to 49 years old have type 1 herpes. That's the common herpes fever sores, and it's down from 59%. I don't know if that's supposed to make us feel better. I mean, half of our adult population, I guess, has this right from teenagers on up. And the genital herpes, herpes 2, is now down to 12% from 18%, but you're talking about all of America. That doesn't make me too happy. Science magazine reported on an interesting article that the gut bacteria that we all have, E. coli, somehow can cause inflammation in some of us that leads to mutations in the cells that then cause gut cancer. So they're finding out that what is the cause of colon cancer, which is one of the leading cancers? It may be that our own bacteria are inflaming us, and that may be a way to prevent it if, eat your yogurt and acidophilus and what have you. Science magazine also said, and this is interesting, that a drug that's used for hepatitis C may also be helpful with the Zika virus, especially if a woman is exposed and wants to kill it before her baby is damaged. Sofosbuvir. So it looks like we're making some headway with that. And this is also interesting. Japan has come up with a new drug that they claim will work faster than Tamiflu. Hopefully it'll be in production by the end of next year. Wall Street Journal, we're still having trouble getting our supply of IV solution bags back. You know, when you go into the hospital and you get an IV, they hang some salt water or saline. Those solution bags are still in short supply, which are may affect our care in some of the hospitals. Apparently, the Puerto Rican company that was damaged in the last storm, half our supply comes from there. And Fox News, I know we talk about humans, but our dogs are very important to us, and Fox News wanted to remind us that the dog flu is still pretty bad. I myself got my dog his flu shot. Just be careful with that, especially if you have to put them up in a kennel.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership. It's for Brazilians. It's $45 a month, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
All right, let's move on to health and safety tips. The Washington Post says, I don't know if you're all familiar with this, there's an herb called kratom, K-R-A-T-O-M, and the government says that it has really no approved use, but somehow if you take it in high enough doses, it has opioids, and it's caused problems. It's some kind of herbal supplement. Many states have gone so far as to even ban it. So, we're all into herbs and natural things, but be careful with this herb. CNN says that, and this is very alarming, a French company, Lactalis, the largest producer of baby milk powder in 83 countries, admitted that for 13 years it has been contaminating its baby milk with salmonella. You can't make this stuff up. I mean, oh my God. So I think they're finally said they're going to clean their machines or something. So hope they do something. New York Times says that Toxocara, as you all know, this is a parasite, and it's found in 5% of Americans exposed through playgrounds and things. So, just because your kid's in a playground doesn't mean they're safe. That's 1 out of 20 of us in America has been exposed to this parasite. Business Insiders, I thought this was an interesting article, so that's why I wanted to tell you. They said that frostbite takes place in 30 minutes when it's 0 degrees outside, and we've had a lot of that, and only 15 miles per hour wins, in 30 minutes you can have frostbite, so please be careful there. CNN, this is really fun. CNN has reported on News World Reports some really fun diets. The DASH diet, which you know stands for Dietary Approach to Stop Hypertension. We're all familiar with the Mediterranean diet, which is basically grandma's sensible Italian diet with all the right stuff to eat. The flexitarian diet, which is basically vegetarian. Weight Watchers, something called HMP, which is Health Management Resource Program. Something called the Mind, something called the 30-Day Diet, and the Keto Diet, and the Dukin Diet. Those two are very hard to stay on, but just to throw around some interesting names. And the last thing I'll mention is that the Food Network, and this was done by Christy Harrison, who's a registered dietitian. I thought this was kind of fun. You know, we're all trying to figure out healthier ways to eat, and we have to read things in menus, but there's hidden things behind the names, and we've done this before in buying eggs and chickens and all sort of things, but she did this with general menu stuff. So let me throw these out at you. When you see something is cured, it means it's salted. When something is flaky, it means it's buttered. When something is crispy, it means it's breaded and deep fried. When something is au gratin, it means it's buttered, creamy with cheese. And when something is braised, it means it has wine and vinegar. As always, I've enjoyed spending this time with you. We always welcome your comments. Enjoy the President's Day weekend if you're hearing this before that. And we look forward to hearing you, to being with you again next month.